Basic first aid. Bleeding. Apply direct pressure with towel or gauze until bleeding is stopped. Clean minor cuts with hydrogen peroxide. Apply antibiotic ointment and Band-Aid. Sprains. Apply ice immediately to swelling and off and on for next 48 hours. Seek referral for evaluation of injury. Ibuprofen may relieve pain and inflammation. Elevate extremities where swelling is present. Compression with elastic bandage may be helpful. Burns. Treat minor burns with cool water or cool compress. If there is blistering, seek referral for evaluation of injury. Antiseptic sprays containing benzocaine may provide temporary relief. For large burns, go to emergency facility. Bug bites and stings. Apply ice immediately. Remove stinger if visible. Apply antihistamine cream to site. Take 25 milligrams Benadryl by mouth. Elevate if sting is on leg or arm. Go to emergency facility for breathing difficulty or extreme swelling. Rash, poison ivy. Wash area with antibacterial soap. Try not to scratch. Apply antihistamine cream or hydrocortisone cream to rash. Wash hands after applying. Take Benadryl by mouth to relieve itching. If not improved in 24 hours, seek referral for medical treatment. Colds, congestion, sore throat. Increase cold fluid consumption. Take decongestant product for congestion according to label. Use throat lozenges if needed according to directions on label. Take Tylenol for headache, fever, or pain. Seek medical referral if symptoms do not improve in 48 to 72 hours or if fever over 102 degrees Fahrenheit, stiff neck, or repeated vomiting occur. Vomiting. Take small sips of ginger ale, weak tea, Sprite, or ice chips every 5 to 10 minutes. Emetrol liquid may ease nausea. Take as directed on label. Once liquids are tolerated without vomiting, try crackers, toast, bananas, applesauce, rice, or clear soups for the next 24 hours. If tolerated, work up to a bland diet, no fried foods, fatty foods, or roughage, and then back to a normal diet. If vomiting is persistent or accompanied by a fever over 102 degrees Fahrenheit or stiff neck, go to emergency room. Diarrhea. Try kaopectate or Imodium. Follow directions on label. Stay on liquid diet until condition improves. If tolerated, work up to a bland diet. Avoid fried foods, fats, and roughage. over the next 24 hours, and then go back to normal diet.
Basic first aid supplies to keep on hand. Band-Aids, gauze pads, elastic bandages, acetaminophen, Tylenol, ibuprofen, Advil, Motrin, hydrogen peroxide, antihistamine cream, Benadryl, antibiotic ointment, Neosporin, Polysporin, hydrocortisone cream, Benadryl capsules or liquid, antibacterial soap, Dial, antiseptic spray containing benzocaine, decongestant tablets, Sudafed, throat lozenges, cotton balls, cotton swabs, antacid, Tums, Maalox, Mylanta, anti-diarrheal, Imodium, kaopectate, salt, anti-nausea, Emetrol, Pepto-Bismol, cough syrup, Robitussin, Vicks, thermometer, calamine lotion, Caladryl lotion, carbon monoxide poisoning. What is carbon monoxide? CO is found in combustion fumes, such as those produced by cars and trucks, small gasoline engines, stoves, lanterns, burning charcoal and wood, and gas ranges and heating systems. CO from these sources can build up in enclosed or semi-enclosed spaces. People and animals in these spaces can be poisoned by breathing it. What are the symptoms of CO poisoning? The most common symptom of CO poisoning are headaches, dizziness, weakness, nausea, vomiting, chest pain, and confusion. High levels of CO inhalation can cause loss of consciousness and death. Unless suspected, CO poisoning can be difficult to diagnose because the symptoms mimic other illnesses. People who are sleeping or intoxicated can die from CO poisoning before even experiencing symptoms. Self-care at home. Move all family members and pets to fresh air away from the source of the carbon monoxide. No home therapy is available for carbon monoxide poisoning. You must seek medical care in a hospital emergency department. How can you heat your house safely or cook when the power is out? Never use a gas range or oven for heating. Never use a charcoal grill or barbecue grill indoors. Never burn charcoal indoors. Never use a portable gas camp stove indoors. Never use a generator inside your home, basement, or garage, or near a window, door, or vent.
Household chemical emergencies. Before a household chemical emergency, buy only as much of a chemical as you think you will use. Keep products containing hazardous materials in their original containers, and never remove the labels unless the container is corroding. Never store hazardous products in food containers. Never mix household hazardous chemicals or waste with other products. Take the following precautions to prevent and respond to accidents. Follow the manufacturer's instructions for the proper use of the household chemical. Never smoke while using household chemicals. Never use hairspray, cleaning solutions, paint products, or pesticides near an open flame. Clean up any chemical spill immediately. Use rags to clean up the spill. Wear gloves and eye protection. Allow the fumes in the rags to evaporate outdoors. Then dispose of the rags by wrapping them in a newspaper and placing them in a sealed plastic bag in your trash can. Dispose of hazardous materials correctly. Take household hazardous waste to a local collection program. During a household chemical emergency, be prepared to seek medical assistance. Call Poison Control at 1-800-222-1222 and follow directions. If there is a danger of fire or explosion, get out of the residence immediately. Do not waste time collecting items or calling the fire department when you are in danger. Call the fire department from outside using a cellular phone or a neighbor's phone once you are safely away from danger. Stay upwind and away from the residence to avoid breathing toxic fumes. If someone has been exposed to a household chemical, find any containers of the substance that are readily available in order to provide requested information. Call emergency medical services. Follow the emergency operator or dispatcher's first aid instructions carefully. The first aid advice found on containers may be out of date or inappropriate. Do not give anything by mouth unless advised to do so by a medical professional or poison control. Accidental poisoning. Before poisoning, place the poison control number near the telephone. 1-800-222-1222. Do not leave children alone or unattended. Be aware of all potential hazards in your home. Never call medicine candy. Teach children to ask before putting anything in their mouth. Keep activated charcoal on hand. After poisoning, stay calm. Call the Poison Control Center at 1-800-222-1222. Follow the Poison Control Center's instructions. For inhaled poisoning, immediately get the victim to fresh air. Avoid breathing fumes. Open doors and windows wide. If the victim is not breathing, have someone call 911, then start CPR. For poison on the skin, remove contaminated clothing. Flood skin with water for 10 minutes. Call the Poison Control Center at 1-800-222-1222. Follow the Poison Control Center's instructions. For poison in the eye, flood eye with lukewarm, not hot, water, poured from a large glass 2 or 3 inches from the eye. Repeat that process for 15 minutes. Call the Poison Control Center at 1-800-222-1222. Follow the Poison Control Center's instructions. For swallowed poison, do not give the victim anything to eat or drink. Call the Poison Control Center at 1-800-222-1222 and follow the Poison Control Center's instructions.